Good morning, all. Thank you for joining us. We're just going to take a couple minutes to let everyone get in. We do have quite a few attendees on this nice snowy day, so we're here. Just give us a couple minutes to get started. Welcome to the presentation. We're just giving everyone just a couple minutes to get in and get their audio set up. So if you can't hear me, please feel free to use the questions bar or the chat. Good morning, welcome. We'll start in just a few minutes. Hello, all. Welcome. We're going to start the presentation at 10:02 to give everyone some, a chance to get in. So if you didn't get to top off your coffee this morning, you've got just a few more minutes before we get started. Good morning, all, and welcome. Welcome to AAA's Medicare presentation. We'll start in just a few minutes. Thank you guys for being prompt and on time. We're going to just give everyone just 2 more minutes to log in. You all know that sometimes technical issues happen, so we'll give them just 2 more minutes and we'll get started. Thank you again. Welcome, guys. We'll get started in just a few minutes here. We're going to start at 10:02, letting everyone get in and get their audio set up. Okay, by my clock, it says 10:02. We'll get started. Thank you for your patience. It is me today. My name is Sarah Wallace, and Elizabeth Sharia is with me as well from Buffalo. Say hi, Elizabeth.
Hello, everybody.
Thank you for joining us today, guys. On our presentation, we'll get started on solving the Medicare puzzle. So how is AAA involved? AAA is here to get you there. We don't cost anything extra to talk about your Medicare journey. It's complicated and government created, so we're here to help you identify and avoid the pitfalls that usually come with Medicare. Some of you are turning 65 and are already eligible. Some of you are doing your homework a little bit early. We can help you really identify where you are in the path, and me and Elizabeth are dedicated specifically to the Medicare questions. Our calls are recorded for accuracy and compliance. We can also do video conferencing if that makes it more comfortable. We're not asking you guys to come into the office anymore, with 2020 and COVID. We want to specifically keep everyone's health in mind, so we can do everything virtually now. That's where this webinar series came from as well, to kind of make sure we can still get that information out there to our community. You don't have to be a AAA member to get our help. Your spouse or partner doesn't have to be a AAA member to get our help. We're really here to help educate and, sign you up through, what's right for you. All documentation is available digitally. We can email it to you immediately after each appointment. So any information you need, it'll be quick to you. We're no longer relying on mail. We don't have to hand things to you personally. We've really been, we've got multiple channels. Now, that doesn't mean we won't see you personally. If that's the way you prefer, we can absolutely accommodate, but keeping everyone's health in mind, we do go digital. Starting right off, these are some of the common Medicare potholes that we see with our clients. So we'll be talking about these throughout the whole presentation. You'll hear about the enrollment periods. There's different times of year that you can sign up, different events that will trigger an enrollment period. Part B penalties, we'll talk about those and how to avoid them. Physician networks and prescription drug formularies. My coworker Elizabeth is going to go really into depth for them. That's really where, the costs of Medicare come in if you're not careful. And she'll also go into the differences between a Medicare Advantage plan and the supplement plans. So at any point, if you have a question, please don't hesitate to use the question box or feature of GoToWebinar. You can send it privately. That'll send it to just the staff. And I do ask that you do that if you have any personal information involved. We want to make sure we keep your information safe. If you have just a general question, feel free to send it all while we'll answer it as we go. As I don't see any questions, we're going to go right into our enrollment periods. As I can't see you guys, I can't really tell which one of these you fit into. So we're going to talk about all of them. But if you are about to turn 65 or you have recently turned 65, you are here at this initial enrollment period, the one at the very top of the screen. This is a 7-month window, which starts 3 months before your 65th birthday, the month of your 65th birthday, and 3 months afterwards. So within these 7th months is the first time you are eligible for Medicare. If your birthday is on the 1st of the month, I want you to take that and move it up a month, right? So your initial enrollment period would be 4 months before your 65th birthday. That's only if it is on the 1st of the month, but I have had a couple clients who, have that lucky birth date, so it's important to keep in mind. The next enrollment period we are going to talk about is the annual enrollment period. If you're already signed up for a plan, you can make changes every year. This happens from October 15th to December 7th, and you can add, change, or drop Medicare Advantage plans or Part D coverage. So if you find, your plan's not working for you or your health condition isn't where it was at the beginning of the year, this is a good time to compare the plans and make sure that they actually work for you. If you are unhappy with the plan you choose, there is an open enrollment period from January 1st to March 31st, where you can change an existing plan if it's not meeting your needs. This is generally unadvertised. You'll get the mail, you'll get your emails, you'll get, inundated with marketing from the 15th of October to the 7th of December, but you don't really hear much about the January 1st to March 31st period. So I want to make sure you guys do know that that's there for you in case you want to, make sure you made that right option. The last enrollment period we'll talk about today is your special enrollment period, your SEP. These are triggered by specific events, such as retirement. Retirement's a big one. Actually, it's a very big one, especially if you are, on your partner's or your spouse's health insurance. Elizabeth, could you talk about that client you had in Buffalo who was on her husband's retiree insurance?
Absolutely. I don't like to talk about it, but it is a really good example of why you should really pay attention to your special event and make sure that you are going to qualify and what you need to do at that point. I had a lady come into my office a little while back. She was 87, had just lost her husband. Her husband was a retired state trooper, and when he retired, they did allow her to remain on his insurance plan. So she assumed that she had credible coverage and she did not need to sign up for Medicare Part B, which we're going to go into a lot of detail on a little bit later. However, when she was in my office, she said that now that her husband was gone, she could no longer get the plan, and Social Security was telling her that she needed to pay over $1,000 per month in Part B premium, which obviously, at that point in her life, she could not afford, and she was very upset because she was looking at the rest of her life without health insurance. So under the assumption, Social Security has to be wrong, which Social Security does make mistakes. So, they're human like everybody else. But just under the assumption that Social Security made a mistake, we started looking into it further. It turns out, unfortunately, for her, they did not make a mistake. And the reason she was going to have to pay over $1,000 per month in Part B premium is because even though she had coverage through her husband's past employer, her husband was no longer employed. He was no longer actively employed. So that triggered her special enrollment period, and because she did not take advantage of it to sign up for Part B, she had been accumulating a Part B penalty for more than 20 years. So when you are under an employer plan, you have to make sure of a few things. You have to make sure that your employer plan is enough coverage to count as credible coverage, because if it's a terrible plan and they're not covering everything that Medicare covers, then it's not credible coverage, and you'll need to sign up for Part B. If whoever is holding the employer coverage is no longer working, that triggers your special enrollment and you have to pick up Part B, or else you'll be facing the same penalty, the same situation as did my client, which we were unable to help her because unfortunately she was unable to overcome the financial burden, and there was nothing we could do. And it was a situation that I never want to find. I never want anybody to walk through my door and have that be facing that same situation. So just make sure that you can claim all of those. I would say check all the boxes. Do you have credible coverage? Is the owner of the policy still actively employed? Make sure that you're checking all the boxes before you just assume that you can put off Part B.
Yeah. Well, and that's what me and Elizabeth is also here to help you, identify ahead of time. I make her tell that story because to me that's heartbreaking. She did get advice, but it wasn't the right thing for her situation, and it really ended up being a formidable cost for her year over year. So having someone like me and Elizabeth be able to help you understand what steps to take at what point in your life, there's 3 other enrollment periods as well as a special enrollment period that you kind of have to think about, and we're here to help with that. So this is why this is one of the major potholes, especially the special enrollment period. So if you think this is you, I very much suggest reaching out and making an appointment with us, just making sure you're on the right path and you're on the right track. Thanks, Elizabeth. I appreciate it. Any questions about your enrollment periods before we move forward, or where you might land at this point in time? Okay, I'm not seeing any questions, so I'm going to move forward. We'll go right over the Medicare overview and how all the parts work together. So Medicare, even though we talk about it as one word, is made up of multiple different parts. There's Part A, which is your hospital insurance. I want you to think about that as your room and board. That is all Part A covers. Part B covers all of your medical insurance, so your doctor services, preventative services, diagnostics, anything that's necessary or that's, the doctor tells you need to go through during your medical journey. That is usually in Part B. So Part A, room and board, Part B is your medical insurance. These two together are called Original Medicare. Part B, yes, I'm skipping Part C on purpose. Part D is your prescription drug care, and it is a separate part from Original. Give me 1 second. I'm going to read this question. Elizabeth's taking care of it. Thank you, Elizabeth. I appreciate that. So,
Absolutely. If you want to answer for everybody too, I'm gonna just send a little note to you, Sam and Ed, and Sarah's gonna elaborate a little bit further. But I want to make sure I get the answer in there.
Okay. So if you take Part A, B, and D and you put them in a blender, you get Medicare Part C, which is Advantage plans. And that's one of the ways to get your coverage. Before I move forward on the slide, I am going to pause and answer some of these questions. If you are a federal employee, Henry, you usually have coverage. I would suggest talking to your HR representative. You usually have a very good plan. If you have any questions after talking to your HR representative on, how all the pieces work together, we can help you with that. But usually they have the plan set up for you and ready to rock. So I would reach out to them. Great question. Moving through some others. Sue is asking if we'll get a copy of this presentation. We absolutely will. Everyone will receive a recording of the presentation as well. So if you have any questions or you can't quite remember what was said, you can actually listen to it through. Great question. Okay, so Ed asks, if you apply for Medicare before your 65th birthday, do you get coverage before your birthday or does the coverage start on your birthday? That is a really great question. The effective date of your Medicare will be the first day of the month you're born. Unless you were born on the 1st, that's where it goes a month ahead of time. But for most people, your Medicare coverage is going to start the first day of your birth month. Good question, Ed. Luann has a question. Okay, great.
Yeah, sorry, Luann. I can definitely answer that question for you. Luann asked, I'm turning 65 in December, but plan on working past 65 and insured and have credible coverage. You do not need to apply for Medicare Part A and B as long as you do have that credible coverage. Make sure that it is credible, and you can put off picking up A and B until you're going to be retiring. And Dina, when I turn 65 and sign up, do I get a bill each month? Dina, Social Security will bill you quarterly if you are not taking Social Security. If you are on Social Security at the time that you sign up for Medicare, then you will be able to have that deducted directly from, you're not going to be able to. What they're going to do is they're going to deduct it directly from your Social Security checks. So your Social Security is just going to be a little bit less once you sign up for A and B. And Joe, my wife is currently on disability and is covered under my commercial insurance. She turned 65 in May. Does she still need Joe, as long as you are still actively employed, your wife can put off signing up for Part B until you're going to be retiring. Definitely check with your HR and make sure that your coverage is going to be sufficient to to count as credible coverage. You always want to make sure and you check with that. And your wife can stay on it until you're going to be retiring. Once you do retire, though, she is going to need to sign up for that. Okay? And Luann, one more question. My husband plans on retiring before me at 64 when he turns 65. Can I still cover him on my work insurance? Yes. If he's under 65 and not on Social Security disability, he can't sign up for Medicare until he does turn 65. So he'll need to stay on your work plan. And then once he does turn 65, he'll have the option to either stay on your work plan or go on his own Medicare plan. And we're going to need to, we're probably not going to get to all of the questions because we do have so many people here today. So Sarah, if you want to, Sarah's going to keep running through the slides. We'll try to get to as many questions as we can. But if you do have some extensive questions, we might have to set up something afterwards. And sorry, Sarah, for cutting in. I'll let you take over from here.
No, I definitely appreciate it. I did not see the questions coming in, and they came in fast and furious. So I really love questions. Please don't hesitate to cut me off and make sure our members' questions are answered. So again, as I said, Part A and Part B turn into it is considered your original Medicare. And I don't know if you might already have this card. This is the Medicare card. This is what they look like. And when we ask if you have Part A and Part B already, they'll be identified on here for you. You'll either, see both lines or you'll just see the one and then we'll know where to go. So both of these parts will show up on that original Medicare card. And we might ask for those if we're, walking you down your Medicare journey. So what does original Medicare cover? Because honestly, it's not much. It's kind of complicated, but we'll get through it. Part A, again, your room and board, covers your inpatient hospital and skilled nursing facilities. Days 1 through 60 in the hospital, you have a $1,484 deductible. You could stay there 2 days, you could stay there 60 days. Within that time period, that is the deductible used. This day 61 is 90. There are $371 per day, and day 91 and above is $742 per day. This is called your lifetime reserve. In the skilled nursing facility, prices are a little bit lower. Days 1 through 20 are 0, 21 through 100, it's $185 per day. And then a 101, days 101 and above, they're all costs. Part B is where the real substantial financial risk is, because remember, this is your medical insurance. So this is, it leaves a 20% coinsurance that you are responsible for. It'll cover 80% of your physician services, physical speech therapy, diagnostic tests, emergency room, ambulance services, all of those. It only covers 80%, right? So how do you cover the other 20%? And that is where I'm going to bring in Elizabeth, and she's going to go over your options. If you are asking questions that haven't been answered yet, just know that we're going to go through and get you answered by text. I'm going to go through and answer your questions one by one, but I am going to bring my coworker Elizabeth on to talk about how to cover your 20% coinsurance.
Thank you so much, Sarah. Yeah, I see there's a lot of questions, and just as everybody is aware, we have 75 people that were registered for today's webinar. So we're really trying to get through the webinar on time and get everybody out of here, and also answer all of your questions. If we do not get your question answered, please just reach out to us afterwards. We'll also go through all of the questions and reach out to you afterwards and make sure that we get those answered. I think we've got everybody, and I am going to hold off answering anything until the end of each slide so I can make sure I can get through everything. So as Sarah said, you have options besides original Medicare. Like she said, original Medicare is going to leave a 20% exposure for you when you do sign up. 20% could be 20% of anything. That could be 20% of $100, which isn't going to be too bad. It could be 20% of $100,000, which is going to hurt most people if you do have to, if you are facing medical costs that high. So what do? How do you protect yourself from that 20% exposure that Medicare A and B by themselves leaves you? And there are two different options that you can go into once you do sign up for Medicare Part A and Part B, and that is a Medigap or Medicare Supplement Plan, or Medicare Advantage, or Medicare Part C. Medicare Advantage or Part C are the same thing. They're two terms for the exact same product. Medicare Supplement and Medigap are the same thing. Again, two terms for the same product. However, Medicare Supplement and Medicare Advantage are not the same thing. They're very, very different. And I don't see any more questions, so we're going to go ahead and move on here. Okay, so should you consider Medicare Supplement plans? Why should you consider Medicare Supplement plans? What good are they? What's this going to do for you? Well, some of the benefits, it's insurance, so there's going to be benefits and downsides to everything. But some of the benefits of a Medigap plan is there are no networks. You can go to any doctor, any facility, anywhere in the country, so long as they accept original Medicare. Because the easiest way for me to explain to you how a Medigap plan works versus a Medicare Advantage plan is who pays the bills. So when you go into your doctor and you're on a Medigap plan, Medicare is going to pay your bill first. Medicare is going to pay what their share. They're going to pay their 80%. And then your Medigap plan or your supplement plan is going to get paid the difference. Okay? So you're always going to have two cards in your wallet at any given time. You're going to have your Medicare card, the red, white, and blue card that Sarah showed you earlier, and then you're going to have your supplement card. And you're always going to need to have both. Okay, and there's no network. So Medigap plans are really good for people who are looking at maybe splitting their time between two different states. If you're going to be a snowbird and you do want to spend 3 or 4 months in Florida, a Medigap plan might be a good option for you. Okay, and I am going to also have a little aside with that and say that Medicare Advantage plans will cover you out of network for emergencies. They will cover you for emergency services anywhere in the world. Okay, so if all you're concerned about is having emergency coverage, you don't have to get a GAP plan. Okay, Medigap plans are also guaranteed renewable. Okay, what does that mean? Well, that means once you purchase the plan, you're always going to be able to get that plan as long as you're paying the premium. The only time they'll be able to cancel you is if you stop paying for it. But as long as you're paying for it, you're going to receive it. And how is that different from Medicare Advantage? Well, that's different from Medicare Advantage because Medicare Advantage plans do cancel. They can just completely discontinue a plan and you can no longer get it. Or they can completely change how they cover what they cover. And you're no longer going to get the same benefits that you were getting the first time that you signed up for it, which that happened with a major carrier in this area. They took their $0 plan and suddenly started charging $70 per month for it. And a lot of people were very upset and ended up switching their plan. That doesn't happen with a Medigap plan. Okay, and they cannot change or increase your plan price because of your health. Okay, and that's you are going to hear people say, well, if you don't choose a gap plan now when you first sign up, you're never going to be able to get it, or you're not going to be able to get it down later on down the road. You are going to hear that. Okay, and that would be true if you didn't live in New York State. But New York State happens to be a guaranteed issue state, which means if you want a Medigap plan, you get a Medigap plan, okay? So the coverage and benefits never change. It behaves like a true insurance policy, okay? And the plans are very comprehensive. Depending on the plan that you choose, you might have little to no out-of-pocket healthcare related expenses, meaning you might never see a bill beyond the monthly premium payment that you're paying. You know, it doesn't matter if you're in the hospital for 90 days and you have a ton of treatments, or if you're going through physical therapy, you are still going to pay. You're only going to be paying your premium. And Brian, I see you have quite a long question. Brian, I would like to set up a time because we're a little bit more that we're going to be about halfway done here. And so if you want to set up a time to talk to us, I would love to answer your question in a lot of depth. I know Sarah did send you a little answer there, but I do want to go through some more depth and make sure that everything is covered for you. If you do want to reach out to me afterwards, I'm more than happy to talk to you. And I am going to add that I always clear my schedule when I have webinars that I'm doing, so that I am able to answer questions afterwards. Okay, so feel free to reach out to me, and I'm going to put my phone number up at the end. But I don't see any other questions, so I'm going to go ahead and move on here. Okay, so I've been briefly mentioning Medicare Part C plan. And what is a Medicare Advantage? What is a Medicare Part C plan? Well, these are going back to my first example when I was talking about gap plans of who pays the bill. When you're on a Medicare Advantage plan, you are going to have a private carrier card. And Sam, I do see your question. I'm going to get to that in just a moment. You have a private carrier card. And that means when you go into the doctor, when you go into to the hospital, you are going to hand over your carrier card, and that carrier is going to pay the bill. And then you're going to be responsible for some co-pays. You're going to be responsible for some out-of-pocket costs. And some of the benefits to Medicare Advantage is that they have very, very low premiums. When I say very, very low, I mean they start at $0. So you're always going to have to pay your Part B premium, that $148.50. That's always going to be deducted from your Social Security check or billed to you quarterly. But to have a Medicare Advantage plan, you wouldn't necessarily have to pay anything more. You would just have your Part B premium, and you wouldn't see anything else. But you do have co-pays. And Medicare Advantage plans have to cover everything that original Medicare covers, meaning they have to cover your hospital. They have to cover basically everything. You know, there are a few exemptions, like everything. There are a few exemptions, but they cover everything that Medicare covers. And they always offer additional benefits like vision, dental, hearing, gym membership. Some are giving you a reimbursement, like a $20 gift card if you go in for your preventative screening. They're very, very, they like to throw in a lot of benefits because they are, because they do have some co-pays. The co-pays are not terrible, and they do have an out-of-pocket maximum, which means you wouldn't be looking at that unknown 20%. If you did have a terrible year, the worst year of your life, there's an out-of-pocket maximum. So it's not going to destroy you financially. And the plans are most closely going to resemble the health coverage that you had while you were still working. Okay? Now, Sam has a question. My employer is New York State. When I retire, I'm to make the Empire plan as my health coverage because it's valid worldwide. They also say not to take any gap plans. Is that true? Sam, you as a state employee are going to have a separate type of plan. And unfortunately, I can't really answer anything else about what type of plan you're going to have. You're going to need to contact your benefits administrator or your HR personnel. I can tell you that if they give you a Medicare Advantage style plan or a Medigap style plan, you are prohibited from getting any other type of insurance. You can pick up like an Aflac plan that's more ancillary. You can pick up cancer coverage, things like that, but you can't have two different health insurance plans when you are in Medicare. So Sam, for your situation, you will need to contact your benefits administrator and make sure that you understand how your plan is going to work when you retire, because that's not a question that we can really answer for you. I'm not certified in state health plans, unfortunately. I'm state employee health plans. I just know a little bit from what I've gathered, so I can kind of give you a half-educated guess, but beyond that, you will need to talk to them. And I don't see any other questions, so I'm going to go ahead and move on. Okay, thanks, Ms. Sam. All right, so this is just, you decide what's going to work best for you. I always tell people, if you are the type of person that really wants to just concern yourself with paying a monthly premium and you never want to see another bill, if you don't want to have to worry about a copay, and you want to be able to spend several months in another state and not have to worry about only having emergency coverage, then a gap plan is going to be the best option for you. But I do need to also throw in that Medigap plans do not cover any prescription drugs, where Medicare Advantage plans, 99% do. The only Medicare Advantage plans that do not cover prescription drugs are specifically designed for people who have like TRICARE or VA benefits, who have their prescriptions covered somewhere else. Medicare Advantage, like I said, lower monthly premiums, higher out-of-pocket costs when used, but it's not terrible. It's very affordable. Prescription drug coverage is a part of the plan. You get extra benefits. And Ed, no, we do not send out a print of the slides, but like Sarah said earlier, you are going to be getting a copy of this recording. And I don't see any other questions. This is kind of a brief slide, so we're going to go ahead and move on. Okay. So here is where everybody starts getting a little bit scared. And I am going to say to you right now, before we even start, that if you don't have any prescription drugs that you're taking, this is going to be somewhat theoretical, okay? And what I'm also going to say is that your prescription drugs, this is going to be a Part D standard. It doesn't matter what carrier you go to; they all have to adhere to the same rules. And Sue, if you're on Medicaid right now, you will be, if you're still eligible for Medicaid at the time that you go on to Medicare, you'll be eligible for a dual plan, and you are going to have a you're going to have a fantastic plan. You'll be what's called full dual eligible. And I can walk you through everything that a plan is going to look like for you there. I'll set aside some time for you this afternoon if you want to talk then, and I'll get to you in just a moment. I just want to go through the prescription tiers here. Okay, in Western New York, and if you're in Syracuse or Rochester, because we do service those regions, this also applies to you. If you are in this area, all of the carriers have a 5-drug tier program. Okay, what does that mean? That means that whatever medication that you take is going to fall within one of those drug tiers. Okay? Tier 1 is preferred generic, Tier 2 is generic, 3 is preferred brand names, 4 is non-preferred drugs, and 5 is your specialty medications. Those are going to be the most expensive medications that you take, okay? And all of the carriers pay a different retail cost for your medication, okay? So that means that one carrier, and this actually happened just a couple weeks ago to me. I was working with somebody who gave me their list of medications, and I started looking them up. One carrier that I looked up that is traditionally very, very good with medications, they were not only not going to cover one of this person's medications, but to pay retail for it, it was going to cost them over $200 each time they needed it refilled, and it was a monthly refill. So I looked at another carrier, and the other carrier was going to cover it at a $25 copay, and that person, the retail on it was also not going to be, I think it was going to be like $75 was the retail cost on it. Okay, why does the retail cost matter? And Al, you asked, you're on Stellar, what plan is good for you? That is such a tough question to answer because I can't say what's going to be the best plan for you with only knowing what your current plan is. Everybody is different. Every single person on this webinar right now has a different set of circumstances. You have a different doctor network. You have different health needs. You have different prescription drug needs. So what is going to be a great plan for you is not going to be a great plan for Sue or Kathy or Ed. So it's very tough just to say, oh, this is the best plan, because it's not going to be the best plan. And like I said, the person that I met with that I'm giving the example of right now, the plan that I initially thought was going to be a good option for him was, once I started researching his medications, was not going to be a good option at all. He was going to end up having to pay over $2,500 per year for his medications on that plan. Where we looked at a different one, and comparatively, the copays were the same for all the medical, the premiums were exactly the same, but his drug costs on the other plan were going to be right around $400 for the year. So versus $2,500 to $400 is what we're looking at. So Al, to answer your question, what's a good plan for you? I just knowing your first and last name and what plan you're on, I can honestly say I have no idea, but I can help you figure that out. If you want to set up some time with me, we can either talk today or tomorrow. I have some time the rest of this week or even next week. I would be more than happy to go through that and figure out what's going to be a good option for you if you're on the Stellar right now. And Kathy Ann, you are a New York State employed teacher. It does make things different. Kathy, what I'm going to say to you is you are going to need to talk to your HR or benefits administrator and find out what they do for you in retirement. Do you have a health care pension? Some people do, some people don't with schools. So once you know that, then we can answer some of those questions. So Kathy, if you want to set up some time to talk to me, we can go through that, and I can walk you through, if you're not going to have a pension plan, this is what you're going to need to do. If you are, then this is what you're going to need to do. And I don't see any more questions, so we're going to move on, and I'm going to get you out of here in the next 10 minutes, I promise. Okay, so this is going to be a high-level look at what your prescription drug costs look like, okay? I am going to assume that most of you have heard of the coverage gap, or the donut hole as it used to be called. So this is going to be true regardless of the carrier that you go with, regardless of the plan that you choose. None of them are going to offer you less coverage than this. Most of them offer you a little bit better, but it's not going to be, they all have this standard that they adhere to, and sometimes it's a little bit better, okay? So there are 3 different coverage phases when you are in Medicare. There's the initial coverage phase, there's the coverage gap or donut hole, and then there's catastrophic coverage. In the initial coverage phase, you might have a deductible, and your deductible, again, I can say for Western New York, the Western New York plans, most of them do not make you pay the deductible if you're only on tier 1 and tier 2 medications. The deductible will only apply to tiers 3, 4, and 5. Okay? But you're not going to pay a higher deductible than $445. That is what the government set as the deductible maximum. Okay? You may or may not have to pay that. So I kind of go around that a little bit and just say that's something that you'll have to determine based on your plan. But in the initial coverage phase, you are paying your co-pays, whatever they might be, depending on your drug tier. You're paying, whatever out-of-pocket costs you might have, and you're not worrying about anything else. And here's where the retail cost of your medication makes a big, big difference. Like I said, that person that I was working with, retail with one carrier was going to be almost 4 times what it was with the other carrier. And the reason that it matters is because during the initial coverage phase, the full retail cost of your medications is putting you towards hitting that initial coverage ceiling of $4,130. Okay, which you may or may not hit. In the situation of the man that I was working with, he was with carrier A, he was going to hit the coverage gap. With carrier B, he wasn't going to hit the coverage gap. Okay, so once the full retail cost of your medications hits $4,130, you're going to hit the gap. And in the gap, you are going to start paying 25% of your medication costs. So that $2 copay that you were paying now suddenly jumps to $50 every time you've got to get your medications refilled. And you are going to continue to pay 25% until the true out-of-pocket, not the retail anymore. Now they don't care about the retail for some reason. And now all they're looking at is what you've actually paid. And you're going to keep paying 25% until you have actually paid $6,550. Once you have paid $6,550, you're going to hit catastrophic. And in catastrophic, you are going to pay, at that point, you're going to pay the greater of 5% or $3.70 for generic, or 5% or $9.20 for brand name until the end of the calendar year. And it is a calendar year. And so a lot of people never get out of the gap. So if you hit the gap, you might never get out of it in the year before it starts all over. So at the very beginning, Sarah discussed some of the potholes that you're going to run into when you're looking at your Medicare plans. This is a major, it's not just a pothole. This could be the boulder from Indiana Jones rolling towards you that's going to crush you eventually if you don't pay attention to what your medications are going to look like in Medicare. If you are one of the fortunate people who has absolutely no medications that you're taking, just absolutely make sure that you keep healthy. But if you do have medications, it's something that you definitely want to pay attention to, okay? And I don't see any questions about that, so I'm going to go ahead and move on. Okay. So this is kind of just just think about the future. Think about what your situation is going to look like. And a lot of people are very apprehensive about going into a low cost plan that might have some co-pays, because they're like, they might be thinking, what if I have a catastrophic situation where I need tons of coverage? There are ways around that. There are ways to work through that. There are options that you have if you do find yourself in a scary health situation. And that's what we're here to do. We are here to help you understand what are you going to qualify for a special enrollment period? Are you going to, if you have Epic, what are your options if you have Epic? How can you switch your plan then? What are your drug costs going to be? And if you do in the middle of the year when you're on, you know, your $0 plan, in the middle of the year, if you get diagnosed with something and now you have a tier 5 specialty medication that's going to be thousands of dollars a month, what are your options for that? What can you do? And that's why we are here. We are here to help you understand your options. We're here to help you understand what you can do, how you can get that covered, and making sure that you have the best coverage that you can get for yourself. Okay, so what are your next steps? And here's where I said we were going to put up our information so you know who you can talk to. Sarah Wallace, who opened the webinar today, is located in Syracuse. She can do virtual appointments or we can do in-person appointments. You will have to speak to her directly about setting up an in-person appointment. So if that's something that you want to do, reach out to her directly, make sure that she knows what you're looking for. Same with me. I'm located in Buffalo. I also do appointments out in Rochester. And I can also see you in Orchard Park, which I actually love going to the Orchard Park office because it is 5 minutes from my house. So if you are near Orchard Park and want an in-person appointment, I can absolutely make that work for you. And it would be wonderful for me if you could do that. But these are both our direct lines. They ring directly to my desk. You don't have to go through prompts or, you know, trying to get through to us, talking to other people. Those are our direct lines. Those are also our email addresses where you can reach out to me today. And like I said, my schedule is completely cleared for the rest of the day. So if you want to give me a call, if I don't answer, it's because I'm on the line with somebody else. But shoot me an email, leave me a voicemail. I'll get back to you immediately. And with that, Sarah, do you have anything else you want to add?
Nope, same with me. I'm available for any questions. I can email while I'm on the phone. So I just want to say thanks for joining us, guys. We really appreciate it.
And I promised we would get you out of here before 11 o'clock, and I am a woman of my word. So please enjoy this beautiful snowstorm. I don't know if it's snowing where you are, but it is really coming down near me. So enjoy the snow, be safe, be careful, be healthy, and have a wonderful day.